Well, the number of babies born with syphilis in the U.S. is skyrocketing. The CDC says more than 3,700 newborns had congenital syphilis last year. Ann Macvick talked to an infectious disease specialist at Stanford about the disease and the problems it can cause for newborns.
So syphilis is an age-old disease. It has been with humanity for as long as we have been able to record diseases in people. However, over the last several decades, we have been very successful in almost eradicating syphilis. It's a bacterial disease. It is primarily a sexually transmitted infection, and it's actually, in general, easily treated with penicillin when it is identified and treated properly. What we are seeing now, of course, is an increased incidence of sexually transmitted infections overall in the general population. And with that, what we're starting to see as well is syphilis and gonorrhea making resurgences in our overall population. And so what happens is that includes women who have sexual relationships, and can also go under their infections with syphilis, gonorrhea, and other STDs can also go undetected. And so now what we're seeing is a result of this, particularly with syphilis, which can really have very devastating effects on newborn infants.
So what problems could it cause a newborn?
Well, there is something called congenital syphilis, which can lead to infection in the uterus and during the period of pregnancy, and which can lead to many, many bone, joint, heart, eye, brain diseases, infections, and which can leave permanent scars if not treated as soon as possible.
So tell us about some more of the findings of the study. I mean, how bad is this problem?
Well, let me tell you from a population standpoint, in 2012, so just about 11 years ago, we had reached a low level of 335 cases of identified congenital syphilis in the United States. And last year, that number was 10 times higher, at over 3,700 cases. And that may, unfortunately, be the tip of the iceberg, because there may have been not complete diagnosis of all newborn babies. And so from a population standpoint, we're just facing more and more children who are being identified with syphilis at birth. Now, this is something, as I mentioned, that we had really gotten under control, and we're ready to really think about eliminating this disease, because you have to really test every pregnant woman to make sure she doesn't have syphilis during pregnancy, and then treat her to make sure that she gets cured, but also that she does not transmit the infection to her baby. And that's where the problem lies.
So
the problem there.
Go ahead. Oh, I was
well,
just,
the problem. Sorry, you go ahead.
No problem. So is it safe to treat syphilis during pregnancy once it is identified?
Absolutely. There essentially penicillin is the treatment for pregnant women. And again, there are concerns, of course, in the occasional people who are allergic to penicillin who can't get the normal treatment. So that can be a problem, but that's where public health officials and clinicians can actually engage in understanding how to monitor and treat those people. But the majority of individuals who are pregnant who have syphilis can be treated easily. The problem is that it lies in three areas. Number one, as we've seen in the last 10 years, the numbers have gone up tenfold, but 90% of the people whose babies were identified with congenital syphilis were never tested or adequately treated for syphilis during their pregnancy. And it's best to treat it during pregnancy, because when the baby is born, they may actually wind up having very severe manifestations of this infection that affects virtually every organ of their body, which can leave long-lasting lifetime scars and developmental problems, as well as death in some cases. Now, it can be treated in the newborn and the child, but again, it's much better to treat during pregnancy. So the number one issue is 90% of women who were diagnosed with congenital syphilis babies in 2022 were either not tested during pregnancy because they didn't have prenatal care, or because they were tested inadequately and not treated appropriately.
Okay, so we have testing, treatment, and of course, prevention is usually the best way to go about this. The CDC study mentioning some missed prevention opportunities. What are they referring to there?
Well, we have always had in place, well, not always, but for many decades, we've had in place opportunities to test women for syphilis during their prenatal visits. The problem is, as you probably know, is we have many women now who don't have access to prenatal care. And that's a really big problem, not just for the syphilis issue, but for other issues as well. Keeping those pregnant people healthy and able to carry a full-term healthy baby as well as keeping themselves healthy. And so the lack of prenatal care in some areas of the country are a real concern, especially with the lack of public health infrastructure that we've seen after the pandemic. So that's one area, is testing. The second is treatment. As I mentioned, ideally you would want to treat a pregnant person who has syphilis during pregnancy. And sometimes if you're not diagnosed and don't come back for treatment, that doesn't happen. What we're seeing now in many of these cases is these women never had prenatal care and were diagnosed either when the baby was born, or we look back and find out that they actually had a visit or two in an emergency department. And emergency departments are not where you have long-term care. And so people fall through the cracks. They don't get tested. They don't get treated. If they get treated, you need to monitor very carefully, and that doesn't always happen either. So this is really a disease of social demographic inadequacy, resource inadequacy, and inadequacy of public health infrastructure.
All right, well, getting this information out there is an important first step to trying to fix this. Dr. Yvonne Maldonado with Stanford Healthcare, thanks so much for your insight.
Thank you.